Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium. And you're about to hear a story that's really quite remarkable. It's a story about a revolution that has begun in the United States. And I do believe it's one, when you hear it, you'll agree with me that there is the potential for reclaiming healthcare delivery, and creating a better way of delivering care and financing care so that our communities and our schools in particular won't be as ravaged by the health insurance industry as they currently are. So with me today are two individuals who I will introduce. First, Bryce Heinbaugh, who is a Health Rosetta advisor in Ashtabula, Ohio. And also with us is Dr. Jim Lambros, a family physician in a direct primary care practice, also in Ashtabula, Ohio. Jim, why don't you go ahead and start with kind of the background story of what happened before that led to your deciding to go direct primary care.
Okay, I can tell you about the last 20 years in primary care and the significant changes that have come about. 2004, I set up my primary care office, Harbor Medical Clinic, and I took insurance, Medicare, Medicaid, and I was independent from the healthcare system, so I had to do it myself, and it was very comfortable practice. Primary care in your hometown is a nice way to go. So what happened is practice started to grow. We were very fortunate, the timing for us, we were able to grow very quickly, and we started to see reimbursements picking up as the years came by. And as things continued, there got to be more and more documentation, rules and regulations, and increase in overhead, had an increase in personnel in the office. And at the same time, we started seeing reimbursements coming down. At first, we noticed we plateaued for a couple years. And then the last couple years in the practice, we started to see that we were making less money. The insurance companies were getting more demanding and getting more difficult. And so it was getting now 10 years for me into year 2014. So with all that happening and putting the hours in that I was putting in and getting the reimbursement that I was not real happy with that. And then in 2014 is when they said, now we are requiring electronic medical records on a federally approved electronic medical record, which means that I would have had to go in and set up a computer system, turn my office into a paperless office, and to maintain that electronic medical record. So with that additional expense hanging over my head, I thought, well, maybe this would be a nice time to join the healthcare system that is in Ashtabula. We have two large healthcare systems. And so I signed a 3-year contract with the one healthcare system, well known. It's an impressive system because they're worldwide, and let you know how big a system they are. So I joined. First year was an adjustment. The demands were more than I anticipated. As we discussed, I said that I always wanted to set my own schedule, and that's the first thing they said. No, we do the scheduling here. So the front desk of my office would schedule, and the hospital at the same time would schedule. People would call in for primary care, and so we're getting scheduled from front office and also the hospital. So many of our patients, and a lot of patients followed me from my practice to the practice with the healthcare system, and they realized that their appointments now were 10-minute appointments. And then they were asking me to, of course, have my computer in the office and be on the computer at the same time I was with the patient. And I absolutely refused to do that. The patient comes to you and wants to talk with you directly. And I think you need to sit and talk to patients, looking them directly in the eye and being very open. Just the distraction of having a computer in the room and you spending your time on the computer documenting what they're telling you, I do not think is productive. So we were given 10-minute slots, and then we had 5 minutes for documentation. And so the feeling is that all of a sudden now I feel like I'm working in a factory. We've got piecework, and they were not real comfortable with me because they were not getting the number of patients that they wanted. They wanted at least 40 patients a day. They said, we'd like to see 40 to 50 patients a day. And I was in 20, 25 patients a day. And they said, you're spending too much time with patients. I said, but my patients want that time. They need that time. And so I spent the time. So as the couple years went by, it got a little more difficult, a little bit more pressure. They would come in and watch me and tell me that I need to put my phone on in my pocket, and every 10 minutes let it vibrate so I can know my visit is over with the patient. So I felt that that was not how I wanted to practice, and it was very difficult for the patients and for myself. They just don't have the time to do that. So as the time went on with our electronic medical records, as we all remember, they came out with the first generation, second generation, third generation of the final electronic medical record. And the one I was using was Epic, and I think appropriately named, because by the time you get done with your office visit, it's an epic for sure. So the number of things that went on during that practice was that you would see that there was, because we worked for the hospital in our offices, they had a facility fee, and they added a facility fee to every office visit, and the facility fee was $100. Now, when the patients would look at their insurance and see that $100 facility fee, they certainly came right to me and asked me, what's this all about? So some of my patients told me, I will see you once a year, or I will see you twice a year because of the facility fee. So things like this were starting to turn my patients off, certainly turned me off, and it made it much more difficult to get done what you want to get done. My patients were used to seeing me and spending 20, 30 minutes talking about more than one thing, one issue. And when I was with the healthcare system, we were only allowed to see one problem at a time, and we had to reschedule them back to come in for the second or third problem that they wanted to discuss and take care of. So I was very happy when my third year contract ran out. I was, as I think Bryce had quoted one time, I was sick and tired of being sick and tired, and I was putting more time in than I wanted, and I was not happy because I wasn't getting satisfaction. I wasn't satisfied with the patient care I was giving, and the patients weren't satisfied with the limited time they were able to spend. And the whole idea that just kept bringing them back and bringing them back. So when the contract came to an end, I just said, I think I'm done. And I went and retired. And one thing I want to mention to you all, you need to experience retirement, because you'll see what a beautiful feeling it is. But in healthcare, most of us, as we joke, laugh about, we tend to come back. And a lot of my colleagues have done the same thing. So we come back, but we come back as we want to, and we set the parameters. And the way we can set the parameters is to be able to work around a lot of things. And so when I had my time off, drinking a lot of coffee and thinking about what does Ashtabula need? What are the needs in this town? What was not fulfilled when I was in my primary care office? And the thing that bothered me the most was a patient cannot walk into a facility in Ashtabula and see a doctor. You can't walk in. All the express cares are nurse practitioners. And when you walk into a doctor's office, if you didn't have an appointment, they're certainly going to be booked and not be able to see you. So patients did not have direct access to a doctor in an office setting. And that was the main reason that I was able to say, I think I can do this. And the more I read and more learned about how to practice not in the healthcare systems, realized it can practice without insurance companies, without the government, without hospitals. And the only people I have to make happy is the patients. And so the more I thought about it, I missed my patients. I missed being a physician and being involved with the community. When you retire, if you aren't actively involved in the community, you are you feel outside. So I retired in 2017 in September and got back to work December 2018. And I started a walk-in clinic. I just had set up a $40 fee for a visit, $100 fee for laceration or skin tag removal. And then I had my list of what I do and what I don't do. And it was actually what I don't do. I put on the chalkboard at the desk. There's no insurance, no Medicare, no Medicaid, no sleeping pills, no anxiety medications, and no pain pills. And so the patients got to understand what we were all about. You could come in, and at that time before COVID, you could walk in and we would see you, and $40 charge, and we're in 2021 and it's still $40 charge. So
Jim, if I can interrupt for a moment, I'd like to bring Bryce in at this
Sure.
point. And Bryce, how about picking up from the point where you first had a conversation with Jim?
Yeah, sure. So again, thanks for having me. I kind of will bring it right up to speed where I had heard Dr. Lambros was actually doing this walk-in clinic, and he happened to be the only independent physician in the whole town, if not the whole county. I mean, we're the largest county geography-wise in Ohio, and we're north of Interstate 90 along the lake up here. And I said, Doc, I have to bump into him at a local restaurant in town. I said, I know that you don't know me and I don't know you, but I'd love to have a conversation with you around a very innovative healthcare model. I'm a benefits advisor. The model that I run is under an umbrella of Health Rosetta. And the fulcrum of our model is value-based primary care on a revenue model called direct primary care, where you don't take any insurance or reimbursements from the government, but very simply, our employer clients would pay you directly, and it's a capitated rate. I said, do you have some time to gather? And very, very soon after, we had an opportunity to sit down. I think I interrupted he and his wife, but I was very passionate, as many know about this. And I said, I'll come back with you. And so we gathered. What was really fantastic is shortly thereafter, he had given me kind of the head nod that, hey, I'm interested. I had been working on our Ashtabula area city schools. We were trying to get them to the Health Rosetta model. I had a couple other employers, private employers, a chemical company, a plating company in town. And I said, Doc, we could plug and play you here. I need, gonna have to get some software, practice software, a EMR system and a telemedicine program. And it just so happened that Health Rosetta, our organization, was holding a conference out in San Francisco just literally a few weeks ahead. And so I flew out to San Francisco and had an opportunity to meet a bunch of physicians at the HINT Summit. HINT is the practice software, a lot of these direct primary care practices. So I got to meet with the HINT folks and the EMR system that they recommended. And I think we even used Spruce for telemedicine. And I came back from San Francisco, had met a bunch of physicians who had taken the jump, who had taken the leap, and said, Bryce, whatever you need to help Dr. Lambros be successful, just call. We'll walk them through it. We'll tell them how we're doing it and best practices, et cetera. And we had a gentleman, Dr. Eric Kroll out of Tampa, Florida, who was one of those docs. And Dr. Lambros and I took initiative to get on a call and go from there. We immediately launched, just probably within 6 months of that time period, we launched our first direct primary care practice inside of an employer in Ashtabula, happened to be Ashtabula Area City Schools. Why is that important? They're the 8th poorest school district in Ohio. They were coming off the most expensive healthcare year in their history, just about 385 employees with a healthcare spend of $10.5 million. A PEPY per employee per year of over $26,000. And so they were victims of the fee-for-service model. We knew it. We were watching the claims data, and immediately that was our first target. And Doc and I went in, and really it was a little, we were both a little nervous. We had 2 unions in there, teachers union and the classified union. And we said, hey, we're here to deliver a new model of healthcare, one that's going to provide time with your physician and the ability to have 30 or 60-minute visits. And Doc's all yours. You could, message him. You have access to his cell phone when you need him, but he'll be on site. He'll have ability. You could see him in his brick and mortar, but ultimately we're hiring him at no cost. And so we started to see, and I think it'd be great for everyone, all the physicians in the audience today to hear this, but every time we happen to launch a direct primary care in one of these employers, and we've done it in other states now as well with other physicians, but we typically saw about a 30% immediate enrollment, 30% within the first 90 days of the eligible population on the health plan said, hey, I want to do this. I want to try it. And by the time, the physician, in this case, Dr. Lambros, started making his way on site and people started to hear about this really great way of healthcare, we saw the uptick, over 40%, all of a sudden, over 40% of the populations began to enroll. And more people talking at the water cooler helped the numbers increase even closer to 50%. We have seen this time and time again. It is just a staple of our Health Rosetta model. We also would like to say, Dr. Lambros could attest to the power of this, but we like to say we're running almost an advanced primary care model because we have a concierge nurse navigator program, which means anytime Doc's got to refer out, he's checking with our nurse navigator first for the highest quality specialists or providers to send. And then we're using a community pharmacist. And I think, Dr. Lambros would attest, having that community pharmacist on speed dial for improving patient care has been a blessing. We've incorporated our local community pharmacist on all of our health plans, offering free generic drugs there to really get folks using the community pharmacist. And Dr. Lambros has not only had the ability to minimize prescription costs and usage, but ultimately, between the nurse, the community pharmacist, and the Center of Excellence program we run, we've got an entire care team that's available to these folks.
Bryce, could you speak to the outcomes that you're seeing?
Yeah, so we just, amongst the chaotic COVID times, the city schools, just for example, we moved to this entire model, pure Rosetta model, firing their former Buca carrier. And we completed the first 12 months effective August. And just to kind of put it into the audience's ears, we had a reduction. We came in 21% below budget. the very first year of full-on direct primary care and the Health Rosetta model combined. And what that means to the city of Ashtabula, again, under, Dave Chase would say it, the future of healthcare is local, open, and independent. And what that means is that we kept 2 points district that needs it most. Think healthcare, education, and housing. Those dollars can be reallocated somewhere else for purposes of improving our kids' education. Again, the school district, full on 100% of the kids' breakfast and lunch are provided in our district. They need the dollars here in our community more than they do in the big, healthcare systems or insurance companies and big pharmaceuticals.
And Jim, can I turn back to you and ask, you were very disillusioned, you were frustrated, discouraged, so much so that you retired. What's it like for you now? What's it feel like practicing as a family physician?
Oh, it's back to a lot of the feeling I had the first time without the overseeing by the insurance companies, the government, and the hospital. It just feels really good. I feel very, very independent. I spend as much time as I want with the patient, or as much time as the patient wants. And so the patient is happy, I'm happy, and it's a very free feeling. We do, as the DPC model is originally based on chronic disease management to get these patients on board and in tune with everything, so we can not only control things at the present time, but down the road also. But with my background, I've been able to add the acute care component to this. We are available 24/7. That was a concern for me when I first joined, and Bryce picked up on that as we first started talking. I don't know if I want to be on call 24/7. However, with the school, we have 400 patients, and in the plating company, we have 100. So we have 500 members in just those two practices. And if you are managing them well, you don't get called at night. You'll get called for a kidney stone or something like that, but you won't be getting called. So I was much relieved that working with a small number of patients, seeing them as frequently as they want, and having 24-hour access. On the weekends, we get laceration pictures, rash pictures. They send things to us, and we make decisions, and we're able to handle things very smoothly for the week. And it's a very it's of all the practices I've been involved in, this is the most rewarding, because I feel the patient gets the most care that they can get, and that makes me feel good. We get good results, and it's very rewarding. Doesn't even feel like work.
That is great. So if I can, I'm going to ask you, Bryce, to finish up. In your sense, you talk about this as a community-owned health plan, which I think it is. What impact is it having on the larger community? You kind of gave us an idea of how it's helping the schools, which obviously is very important. But any other comments about the value of the model for Ashtabula, Ohio?
Yes, thanks. Great question, Larry. And to kind of keep it short and simple, we're changing the mental models of folks, decision makers, organizations, and companies in our community. For those employers that are here, we're slowing down this wealth transfer, and instead keeping those dollars local. Employees see pay raises, actually, because their healthcare costs have gone down, they're going to take home more in their paychecks. We see the ability to reinvest in our community. We actually have been talking about ways of giving back, and I'm kind of been a follower of the social impact investing, thinking about things of, if you can control healthcare, how you could reallocate those dollars in things like education and housing that drive social determinants. The meaning behind what we're doing in our community-owned health plan here in Northeast Ohio is a powerful one. We feel strongly that this, we're going to see more and more of a case study, probably national case study around Ashtabula County, Ohio, and we're really excited. People are thinking differently. We just won the actual city of Ashtabula's healthcare. I had a meeting this morning with their leadership team, trying to move to the same direction, following the same steps. It's a recipe. We don't need to change the ingredients, and we're no longer guessing. We have measurable data that's helping us just plug and play for the next employer to get right in a part of the movement. So it's very meaningful, Larry.
So I'm going to bring things to closure here, and thank you, Jim Lambros, and thank you, Bryce Heinbaugh, number one, for being a part of this presentation. But number two, it took real courage for you to do what you've done. And I'm hoping that others who are listening to this in the audience, locally in the Innovators Network, as well as others throughout the country who may hear about this, will decide that they want to follow in your footsteps. We can turn things around, and I think you guys are a great example. Your team is a great example of how to begin the transformation. So thank you very much for participating with us today.
Thank you. Nice.
Thank you, Larry. Yep, we appreciate it. Next to come, the state of West Virginia. We're going to do the same thing down there. So keep an eye out.
That's awesome.